Hey, it's Deborah. Have you ever wondered about stem cell therapy, whether you're a candidate, who does it, or PRP, platelet-rich plasma? What's the difference? And who does them? Do you do them together? Do you do one first? All about it today. I'm sharing my personal experience with stem cell therapy, why I chose it, and what the relationship is to PRP and stem cell, when you might want to do one versus the other, and who are the ideal candidates. So follow along, come with me, and later, as we go down the road, I will let you know how I do and what the changes are for me. That it had been over a year. I had a new puppy. He started getting older and pulling. And at that point, I felt my knee have a little twinge. And I really blamed it on the poor puppy. And my guess is now that that was coincidence. That it may have been he who made me very aware that that happened. But I began to really look at what are my options here. And, when you start feeling something and it's just not going away. So I did all the things. I strengthened my glute medial muscle. So, by the way, if your glutes are weak, your knees and lower back are potentially going to suffer. Other videos here will tell you about that. But I'm going to answer all the questions I possibly can about why I chose stem cell therapy, why or what the difference is between stem cell and PRP, platelet-rich plasma. It's a mouthful. And how you might want to use them in coordination with one another. I'll help you with that too, and I'll introduce you briefly to my Dr. Sabrina Salt here in Scottsdale. And if you're looking at stem cell therapy, she's one of the best. She teaches the trainers, so she trains the trainers or the other practitioners. Okay, so here we go. I'm about to leave to drive to my appointment. The dilemma was, what does one wear for stem cell therapy? And then, I got on this white shirt and I'm like, I might regret that because maybe there'd be blood related to the withdrawal of the adipose tissue, and we shall find out. So I have a jacket just in case, and I'm ready to say goodbye to this shirt if I need to, but I'm late, so I gotta go. Here we go. So all checked in. So yes, don't you love this? So glad I curled my hair. And booties and the whole thing. Blood pressure, check. All that's good. So she's gone to prep. Then what we're going to do is retract or extract the adipose tissue from like the flanks in the back. And then after that, she'll be injecting in both knees. So we'll film the parts that we can, and I'll try and ask her questions as we go. Here we are about to start the procedure. So I'm just reclining. Now she's using a bit of an ultrasound basically. So you'll see on the screen, she's doing this to inform where does she inject. At this point, she's already given me a little injection to numb the site. But that, you see my fat. She, by the way, told me I have beautiful fat. I said, no one ever has said that. Probably no one ever will again, but thank you. So she is injecting it using the screen to guide her, making sure she gets it into the right place. And both times on both knees, she did have to do it again because fat, as you can guess, it's very thick. So it gets a little jammed basically in the needle. So we withdrew, had to start again. She apologized, but it's nothing she could control. And again, very minimal difficulty, discomfort on my part because I was numb. Doing the other side, I'm speeding up on these because you've seen it before. She's looking for the exact injection site. She's moved her screen so she can see it. She's basically watching on television. That was just for numbing. So that's kind of the local analgesic. And then we let that take. And as this goes in, I really don't feel it. There's a sensation, but there's no pain associated with that. So again, gets a little sticky in there when you inject your fat. So it's very thick, it's not fluid. As we go again, she's there looking at the screen in front of her to guide where she's injecting it. It all goes in, and again, what I'm feeling is just sensation. Here, I'm done. She's giving me a little bit of what to expect as far as swelling, inflammation, telling me not to baby it. I can walk normally, but it's going to feel a little abnormal. So I'm going to feel a little robotic, a little stiff. That's normal. I don't have to baby it. Again, I needed to hear that. And yet, the hardest part is not doing regular activity and not exercising to allow it to do all the healing. Then I followed up with a few questions that I know you'll have and wanted to hear from her.
Can you answer this question?
Yes.
So one of my audience members was like, well, are you doing PRP? And how come you're doing PRP and not stem cell, or you're doing stem cell first?
Stem cells.
Yeah.
Stronger than PRP.
Yeah.
Yeah. Stem cells are they're a million times stronger than PRP. So sometimes when you have a really severe knee like yours was, and it's got that severe degeneration, PRP might work for a bit and it might give you a slight bit of improvement. But for the price difference and the fact that you're doing a procedure, like, just do the stem cells.
So somebody else said, I checked it out. Somebody suggested I do PRP first and then do stem cell. Is that just a matter of who it is, who the physician is, or
I mean,
the status of the joint?
I wouldn't have done PRP first with you. I would have told you, like, truly, like, as your friend, as your doctor, I would have been like, yeah, you would have been fine with PRP. But my goal is to get patients better faster. And I don't see the point in doing PRP, waiting 3 months, seeing what it did, and then just doing stem cells anyway, when you can get the full results of the stem cells faster.
And I get that, but I think this individual was suggesting that they said, yeah, we'll do stem cell, but we want to do PRP, like, to create the environment.
It depends. So the person is coming in and they might be a little bit more metabolically unhealthy. Sometimes you could, like, seed and prep the area, but when I do stuff like that, it's usually part of a more comprehensive treatment plan where we're looking at labs, we're looking at hormones, we're optimizing the peptides. It's usually because we have to take somebody from being, like, in a standard American state to a more optimized state to get better healing.
Okay, so I'm walking out with my bag of goodies. I've got some gauze in here. I've got some pads, like, for sleeping, so on my bed, just in case I'm oozing, I guess, which is not a great word either. But that way, until, like, the site where they pulled out the adipose tissue, until that's healed. When it has a scab, then I'm good to go. And that might be 2 or 3 days. The faster I heal, the less I need to worry about gauze. And if you go in healthy for any procedure, you're going to come out healthier and heal a little bit faster. Doesn't matter what it is, but that's true. So right now, just walking out, it's not far to my car at all, but I'm just kind of wondering, right, Alec, I'm curious about, is it uncomfortable or awkward, and might be a little bit more stiffness, more in the right, which is the knee that was having more inflammation and problem. I mean, I didn't have any inflammation in the left at all. We also did it, though, just because we're here, and it probably makes sense to do them both because I'm going to go through the healing process and stage anyway. So any degeneration that's already there, we're going to take care of it and get ahead of it. But I'm about to go upstairs, so we'll see. But nothing is stiff. I feel fine. There's no issues whatsoever. So in the car, all fine. Coming up those few steps, no issue whatsoever. I barely even notice. In fact, it's nothing more and probably less than some major hiking that I was doing at altitude in Colorado for the last 2.5, 3 weeks. I feel better today and right now. So the suggestion is that as the day goes on, I will probably feel a little more stiff and a little more achy. That is natural. So I don't have any Tylenol at home. That's the only thing I can take because you don't want any anti-inflammatory things because you want your body to actually do the work and the healing. That is part of the regeneration. So I'm not going to worry about that. I'm not going to get Tylenol expecting to have a need for it.
I expect it will be a little bit uncomfortable, maybe a little bit of ache, but I sleep really well. So at the end of the day, going to bed a little bit earlier, sleeping, it'll be elevated. That's probably going to be great. The biggest concern I have right now is I'm hungry. So I'm going to go and I'm going to be really careful in the next few weeks, probably a little more so than usual, if that's possible. But I want high protein, I want high quality foods. So that's what I'm about to go do. A high protein kind of quote brunch before I head out.
Okay, so here I am back home. Drove home, had a smoothie, high protein. I'm about to hit my desk and just have a normal afternoon, podcast after podcast after podcast interview today. But so far, so good. So even getting up and out of my car, it was about a 45-minute drive. No stiffness. I mean, not beyond norm. And I don't mean I'm normally stiff, but my right knee, if I sit for too long, can get a little stiff, especially if the air conditioning is blowing on it, oddly enough. But I'm going to show you what kind of it looks like. So all I really got, just a Band-Aid over the two places where the needle went in. So that's it. And here's this. Let me show you this too. So this is a little bulky and uncomfortable just because it's like 107 degrees. So I've definitely got this on. I will pull this down, but this is what is coming in, and it's the compression. So in the back and inside of this, I've got some gauze that is helping to absorb. That's half the battle with anybody who's ever done some kind of surgery or going to do, say, knee replacement or hip replacement. As a medical exercise specialist, I've worked with a lot of people in that capacity. And the goal is we want to get them as strong as possible going into it. So, number one, we want to maintain their lean muscle mass, get them as strong so they're ready. They're going to have a little bed rest. They're going to get a little weaker in bed rest. They're going to, get up and not truly exercise for a while. We want to have them like, let's put as much in the bank as we can, because a little bit will be withdrawn and you will come back sooner and faster because we've got that muscle memory and we've got it there. Similarly here, so I did, I had a very active couple of weeks here hosting a retreat in Colorado and hiking kind of as a way to beat the heat here. I was gone and hiking for 2.5 weeks prior to the retreat. And all of that is great. And I was strength training at the same time. So I've got endurance, I've got strength, I've got stamina. I was eating really well, resting really well. And then here we are. So going into it, the more optimized you are with anything procedure that you're about to do, the better you're going to come out and heal on the other end as well. Okay, so this is the morning after stem cell, which means it's not even officially been 24 hours yet, but just a couple of hours short of it. So you get an idea of first of all, what it was like. Surprisingly, when I went to relax a little bit on the couch last night and go to bed, the sight of the extraction on my lower back was actually a little bit more sore than I expected. So I don't move a lot at night, which is really good, right? So I go to sleep and I sleep. It's like I'm getting the job done. So I didn't have to really worry about discomfort, tossing and turning, if I was somebody who did and rolled over on one side. And then on the other side, I probably would have noticed it enough that it would have, done a little minor wake up, but not an issue for me. Slept really well, but I'm a little more tired than normal, and twofold. I'm going to attribute that to your body's doing extra, whether it's like you're sick and you're getting better, or it's healing, or imagine what it was like if you've been pregnant, what that's like, building a new life. Your body's diverting energy on top of what you might be doing otherwise. But second, I think that if you're used to moving, you're a person who moves a lot during the day. I moved a lot less yesterday. So didn't do much more than walk the dog a little bit in the morning before I needed to go for the appointment. And then afterward, I was busy actually. I've had a busy morning doing that, then a busy afternoon of sitting and podcasting. And by late afternoon, I was feeling the stiffness. So I was already in that moment of I can't do a lot. So I would attribute feeling tired to moving less. If you can relate, you have travel days, you're sitting, you're doing a lot, you feel a lot more tired, but not good tired at the end of the day than had you moved. It's that kind of feeling. So I am going to lean into that and be as diligent as possible. It's not going to be hard not to move a lot today because it really feels stiff today. I'm just going to show you my knee and see if you can compare. So I'm in a standing position right now, and I'm going to bring it down. So looking here, you can see where they did the incisions, and there's a distinct difference between this knee. So there's no swelling and inflammation over here. Here, this is the one that was bothering me. So there's not only an inflammation that was there and existing, but now I've got inflammation here, and this is just a little bit warm, which is natural when you've got healing going on. So this, you can see there's fluid here. And so, it's not, first of all, there's my hand, not the most attractive, but it says there's stuff going on. So it's working its way through. It's like when you're sick and you have a fever or you've had a sprained ankle and it's all swollen up and maybe also warm and painful. That is a good reaction. There's healing. There's things coming in there to make it better. So that is all things that those things should be happening. So I think we're on the right track. It's just a matter of this is Wednesday morning. So I have Wednesday, Thursday, Friday, and then midday on Saturday, I am actually flying out of state to a baby shower, to attend a baby shower. And my hope is that walking through the airport is not uncomfortable, and this girl will have to allow herself a little extra time, which is not a norm, but thinking about things, this is such a great place to be in. The one thing I really am disliking right now, and I'm gonna again bring this down. So I have my jammies on, but I also still have this huge girdle around here. So it's compression. So it's like a very thick girdle, so what it feels like. And I'm like, I would never have survived in those times when they did corsets, because I cannot wait to take that off. But I've got 6 more days of it. So I actually have to wear that when I fly, and under a dress and whatever I'm going to wear to the baby shower. I had thoughts and visions that I would go to the pool to relax, and I don't see that happening in a corset and compression. So, my schedule just changed a little bit. So there are things that, I'll have to tolerate, but it's like, this is now, and I'm choosing it, and I can plan it, as opposed to, say, you're required later to have surgery. You're going to do something worse, get injured, have to be laid up. This is still bringing me back to, this is a choice I can make right now and have, and I want to do this so that I'm back out there on the trails and hiking and lifting heavy again within 3 to 4 months. That wasn't restricted. I was doing everything I really wanted to do. But at the end of it, I was noticing that it wasn't the result I wanted. So I just want you to realize, what was my frame of mind in making the decision to do this? It was being proactive. Okay, it's day 2, almost 48 hours after the procedure. It's 46, literally. So just want to give you an update. And literally I'm in my pajamas, because everything just, it doesn't take a lot longer, meaning I'm so slow and I can't move around, or I would think twice before going to the grocery store, but I kind of have,
I'm like, do I want to get in and out of the car and go do it? And the bigger thing is it's 107 here, so you either want to go early or go late, just because it's not fun to get back into a super hot car. But I'm really doing okay, and slept for about 10 hours last night. Although ordinarily I go to bed early, I really crave good sleep, and I can sleep 8 to 9 hours is really my sweet spot. I like extra sleep, especially as I get older. It is the one recharge that we all should afford if you need it. But 10 hours last night at 7:30, I was like, I am so tired, can't keep my eyes open, so why am I fighting it? Moses let me sleep till about 5, so that was great. So almost 10 hours, a little less. I probably would have gone to 10, and I was ready to get up. But I'm also noticing better range of motion. So when we sleep, of course, we're horizontal. So from that, I know I probably should prop my leg up a little bit more today, and I probably won't have quite as much swelling if that's true. My left knee, both were done. The problem knee for me, noticing the inflammation, the swelling, the feeling full is how I describe it. So I could come down in a deep squat, no pain associated with that, but the knee felt full, like it was getting in my own way. That's the kind of thing I would notice at the end of a hike. I wasn't sore, it didn't hurt. However, it was full, like it was complaining and telling me something is wrong. So where I'm at now, I'm sitting on a bench, I'm just swinging my legs freely back and forth, not stiff while doing that. Standing up and walking, still a little bit, I'm aware of it, but it's better than yesterday. Already I'm noticing the inflammation is down, the range of motion is better. So the biggest thing for me will be keep myself pulled back. So I'm not going to be going, quote unquote, for a walk, even though normally, right, that's the opposite of what we'd recommend. We would say get active as soon as you can. So I will be active intermittently, like getting up and down and moving around the house, but not quote unquote going for a walk, because what's happening in this stem cell case is like your whole body is trying to say, okay, let's focus and heal. So even though momentarily I may lose a little muscle mass, I may feel a little more bloated, like I'm a rotating foot, because I'm not exercising. And that is just, you've got to be prepared to do that, because as women, specifically in midlife, that could have happened to you, when you were younger, or 10 years ago, if you're postmenopause, as I am. I don't notice that right now, but that will happen. And if you sit for long periods of time, your ankles and lower leg is generally accumulating some fluid. Most women I work with notice that, just even on a small basis. So I can do some things. I can put my legs on top of a power plate, whole body vibration, to get some movement in. So that's not necessarily exercise. It's just helping circulation. And circulation is good for healing. So we don't want to be stagnant and lay on the couch only. We do want movement. And when you've got one leg different than the other, you want to maintain your core. So even yesterday, I did just a little session of core exercise. I'm really aware when I'm sitting up that I'm not slouching, I'm lifting, holding still, and that I'm aware of staying in balance. So when you've got a knee issue or an ankle even, you want to think about, am I staying and keeping my hips equal? Am I keeping my rib cage even, my shoulder blades even, and I'm not limping and favoring? And being careful that if you have to limp, that you're getting down on the floor and you're keeping that regulated by focusing on your core, extension, flexion in ways that make sense laterally, moving over, getting some simple and easy stretches, not necessarily on that part that was affected, but for my spine, and rotating and staying active and isometrically. Finding times for exercises I normally might not find time for. This, if you look at it like that, when you're healing, is an opportunity, good things can happen. So, hope that was helpful for those of you who also may be going through recovery from an illness or from an injury or from a procedure like me that you volunteered for. Remember doing it sooner rather than later. So imagine taking a month off when you were 70 or 80 as opposed to when you're 61. you are much more vulnerable to time off. So we don't want that to happen, and it's why I'm proactively taking care of this right now. But above and beyond, I am active and want to be active, and I'm 61. So the reason I decided to do stem cell therapy and to take action was, first of all, I tried everything else. I was having just a little niggle. You know what that is? That's just something is telling you it's not quite right. It's like, this is not the way it's always been. I can't just thoughtlessly go do something and or do a really long hike without, do I want to think about that? Am I worried about that being too much? And I started to get there. I was still lifting extremely heavy, not limited in doing that whatsoever, but I began to have this just little, it feels different after I do that. And a puppy actually made me very aware of it. That asymmetrical pulling from a puppy made me aware that the inside of my right knee, we call it the medial side, was a little tender, not pain, just enough to say, there's something there. So I did all the work that I would do with a client as a medical exercise specialist. That is strengthening the glutes. If you have an issue with the knee or you have an issue with the lower back, the first place we're going to go is mobility of the hip and weakness of the glutes. If anything is there, we've got to fix it. The good ratio between your hamstrings and the back of your legs, which tend to be tight, and the quadriceps or hip flexors in the front, which tend to be shortened and dominant. So looking at, do I have a good balance? Do I have the strength I need in my glute medial muscle, which tends to be lazy, and in the glutes in general? And all of that checked. I was doing it, but still struggling. So I am not a candidate for a joint replacement. I am nowhere close to that and don't want to be. So I'm not putting my hand up for that now or 20 years from now. That's actually why I decided to do stem cell therapy. Number one, I'm a really good candidate because I'm healthy, because I have a good diet, because I have good lifestyle habits like recovery and sleep. We all have a little stress, let's admit that, but I can cope with that stress. I know I have a good sense of humor. I have people I can call to laugh about and laugh at the world about, and the stress didn't go away, but it's better. All of those things make you a good candidate for something like stem cell or PRP because you're going to recover well. The environment's already good, and you will recover well because that environment's good, and you're going to come back to those good habits. That makes you a good candidate. So seek out a doctor who will tell you most likely the same, but who would also qualify you. Is this good? Now, if you've had a lifetime of eating sugar and or drinking a lot of alcohol on a daily basis, even 1 to 2 drinks could change things just a little bit. And if you don't get adequate micronutrient density, enough calories, total protein, that again could be a limiting factor with you getting what you need. But if you take good care of yourself, that's probably not you, or you wouldn't be here watching. So if you're a good candidate, the question might be, what's the difference between PRP and stem cell therapy? And I'm going to show you later Dr. Sabrina Salt, who actually did my stem cell therapy, her response to that. So much better to hear it from her. But in my very lay terms of why I was looking at stem cell is because that's for permanent change, for repairing damage done just in wear and tear on the medial side of my knee. And, no amount of conditioning my glutes or the quad is going to help that. PT is to strengthen soft tissue. When you've got bony structure problems, that's degeneration. You have to go to the bone to get the support. So that's what I did. PRP is creating an environment where you have less inflammation, so you're going to heal better and faster, and creating this environment where you have less swelling. It's conducive to taking the stem cells in. So it might be used in preparation, and it also could be suggested, even to me, follow up down the road. We don't know yet. My placebo mind is saying, all I'm going to need is this, and I am healing really well, and I'm going to focus on that, and I'm going to
be the best patient outcome she's ever had. So if you're thinking that going in, not wondering, is this going to work? I'm absolutely certain it's going to work. That's going to help. And whether you believe in the woo-woo or not, placebo effect has actually been studied and we know it to be true. Now, it works to be true if you're doing the right things, right? So if you believe and you're thinking, these things are helping me, and they indeed are, you're going to get much better results.